Welcome to Talk of the Town. I'm Robyn Zimmerman. We are at Hospice Care of the Lowcountry with two very special guests because November is National Hospice and Palliative Care Month. We have Chris Butler. She is with Lowcountry Palliative Care. And then we have Alicia Mayner, and she is with Hospice Care of the Lowcountry. And we're going to talk about the difference. Let's start with that between palliative care and hospice care. So let's start with you, Chris.
So palliative care, I tell people to think of it like a specialty medicine, just like cardiology or oncology. And we provide supportive medicine for people in the homes that may be going through treatments, that need a little extra help with those side effects of the treatments, or maybe just symptoms of the illness that they have. And I think the main difference is that most of the palliative patients are still trying to receive some type of curative treatment, whereas hospice patients, the focus is going from curative to comfort.
So can you give me some examples of diseases that would be chronic diseases that would need palliative care?
So cancer is always a top one. Cancer causes a lot of symptoms for a person, just the illness itself, but also the side effects of the treatments cause a lot of illnesses. And sometimes people get to the point that they're so weak they cannot tolerate even receiving another treatment. So that palliative support helps strengthen them so that they can continue on with their treatment.
All right, so Alicia, now hospice care, what is the difference?
So hospice care is slightly different from palliative. Palliative is going for the curative treatments, where hospice care is taking care of the individual when curative treatment no longer is available or going to work for them. So what that takes is we take that patient, the family unit in a whole, and we provide comfort, dignity whenever it's getting closer to their end of life.
And you mentioned the caregiver, the family. For both of these patients, all of these patients, it's very holistic, isn't it?
It definitely is. Palliative for sure, because there are multiple different physicians and specialists on that person's care team, and our services provide care coordination for the patients and their family members amongst all the people on their care team.
And Alicia, with hospice care?
For us, it's definitely holistic for the fact that we're actually taking care of the patient's family in a whole. It's not just the patient. This is actually affecting the entire family and friends, believe it or not. So we offer bereavement services, we offer counseling, we have chaplains involved, lots of volunteer work as well, just to kind of support that family any way we possibly can.
Now, how does hospice care and palliative care complement each other?
A lot of times with hospice, what we're looking at is sometimes when our patients are in palliative and they receive that curative treatment and they get to the point that it's no longer available, they're actually coming on to the hospice side. That's when we're actually saying, okay, we can't go further on with the treatments, but what we can do is give you a great, wonderful life with your family that's filled with love and support. Palliative actually complements us a lot. We actually tend to have some patients that are a little hesitant to come over into the hospice component because of the hospice name itself, but Chris works really well with them to explain to them that this is actually continuing the support system.
So it's a very emotional time.
Oh, absolutely, especially in palliative, because we're often getting referrals for patients who are newly diagnosed. They don't understand their disease, the disease process, what the trajectory looks like. And so all along the way in the palliative care, they're receiving continuing education about their disease process and what to expect.
And so you all are, of course, the care team, but you're also really becoming part of their families of these patients. So you get, I would think, attached.
Yeah.
They're letting us in their home at the most vulnerable time of their life. It's the most sensitive time of their life. So there's emotions and feelings that are being shared between them to us that we're helping guide them through. And it can be we sometimes mourn with the patients' families.
And you all work as a team often together.
We all work as a team here.
Everybody, we're a family unit in ourselves. There's not one time that I can't imagine that I haven't called on Chris or I've called on some of my other team members to get their advice.
So thank you, ladies. Chris with Lowcountry Palliative Care, and also Alicia with Hospice Care of the Lowcountry, for being on Talk of the Town.